Hello, Mr. Perry.
Hello.
Hi, can you hear me okay?
Yes, I can.
Hi, my name is Dr. Shantella. Oh, let me get my camera working here.
Yeah. I don't know if it was me or you.
There we go.
Hey, how's it going?
Good, how are you?
Been better, but you know how it is.
Okay. Well, my name is Dr. Shantella. I'm assigned to do your evaluation today. So this is a compensation and pension claim for PTSD. Does that sound right?
Yeah, they were. It was supposed to be bipolar. I have a claim for bipolar PTSD and fibromyalgia, and
Okay.
the VA says they're bound. They already said yes, he has it,
Okay.
and they sent me to a CMP examiner, and the judge asked him 4 questions. He asked him the etiology of PTSD, bipolar, and to look at something, and can you get it from verbal abuse? And the CMP examiner did nothing. And I think it says on, I don't know if you got the same copy for the Board of Veterans Appeals that I did, and what it asks and says.
I have the initial. This would have been, was this last year?
This would have been sent out. The last year was January 19, 2023. This
Right.
one was February 9th, 2024. The new one is what he's asking about. But yeah, he didn't do anything the judge asked, and then he gave me a diagnosis of something that out of 12 doctors, I mean DRs, you know.
Yeah, the schizotypal.
Yeah. And at the time, I was taking a CPT course, you know, a 12-week course through the VA in Prescott, Arizona.
Okay.
And I told her about it, and she goes, no, you know. And I don't know if they gave that to you, Dr. Sigler. Did they give you her records?
Let me see here. I do have rating decision ones. I'll have to look through that.
I've been diagnosed, 2008 I was diagnosed by the head of PTSD in Chicago, Dr. Young. It took 12 years for that to get in my problems list.
Oh my goodness, I'm so sorry.
I have, after that, I had 4 residents in the Chicagoland area, and then I went to Phoenix. I met a lady. She didn't ask me anything about it. She was an NP, and she says, I bullied Dr. Yant into making a factitious diagnosis. Criterion F wasn't met, and if he's able to cross the country, maintain a relationship, and advocate for himself, she took all of them away. All my diagnosis is from Chicago, okay?
Oh wow. Okay, I do see the one from February 2019.
Yeah. And if you look at what he asks, they were pretty simple things, you know. Etiology, can you get it from verbal abuse for bipolar and PTSD? I mean, like I say, I've got 13 psychiatrists with a diagnosis of PTSD. 2
Right.
from the state of Indiana that did like all-day tests, you know. And he says the same thing. So, you know,
Okay.
the only one that hasn't was Zoe Forrester. That's the one I just told you about, and this guy here and he didn't even read the initial document. They're fighting me on one piece of paper, and it says everything right in it. The very first line is, I don't like fat. I was lucky with my CPT doctor. She doesn't like fish. And I mean, she really hates fish. I don't like gristle on meat, you know, fat and gristle. And I took the reason I got all this to happen was I went on emergency leave, and when I came back May 10th, we went to the chow hall. They were going to have me. They said eat some of this meat, and I said I can't. It's fatty. I will throw up.
Okay.
So he piles it on. Sends me over to this is 1974, and I had 7 drill instructors. You know, they beat people up back then. They took them to the head, you know, and not that they did it to me, but they, you know, I could see it coming. So they
Yeah.
said, clean the plate. So every time I ate something, I threw it up, and I had to clean my plate. And we were there an hour, and I had to clean my plate. And the very next day, they said, Mr. Perry's being sent to psychological evaluation for unable to retain mess hall food. To me and everybody else, that's an admission that a psychiatric event happened, or else why would they send me to psych
Yeah.
eval? All right?
Right.
So the day that I was supposed to go to psych eval, they kicked me out of the Marine Corps.
Okay.
This is punishment because they had two choices. They could
Yeah.
start me over.
Yeah. They're just trying to get out of pain.
Exactly. Yeah, and it's and the
Did
personality.
You get an honorable discharge?
I got it honorable. Yes.
Okay. All right. Let's start
Sure.
at the beginning. So
Sure.
I'm gonna, as you probably remember with the last ones that you did, I'm gonna ask questions about before, during, and after your time in service.
Sure.
Let's start with some social marital family history. Mr. Perry, where were you born?
Oak Park, Illinois.
Okay, is that where you were raised?
I was raised in Cedar Lake, Indiana, about 40 miles from there,
Okay.
just over the Illinois line.
Were your parents married at the time of your birth?
Yes.
Did they stay married?
Yes.
How was your relationship with parents growing up?
I had a fine, I don't know if you can see the guitar in the back of me.
I do. I see two of them.
No,
Or
you
is there
see,
one?
you see one.
Ah.
So I put them together, and I'm very creative. I got a kayak outside, and I used pedals to kayak. I just went down 50 miles of the Colorado River this week. So I got along with my parents, but I was a handful. You know what I'm saying? And people spanked people back then. And I don't know, I didn't have it coming. He'd say, "You're grounded," and I'd be at the lake swimming the next day. You know what I'm saying?
Okay.
So,
Yeah.
but, it wasn't they were beating me or anything like that, And I was just fine. When I quit to go in the Marine Corps, I was working on, I had 3 drafting courses out of 5 courses a day. So, I was all set to do that, went in the Marine Corps, and my mistake was taking emergency leave in the Marine Corps. That
Tell me about any siblings growing up.
I have 2 sisters. Everybody's dead. My parents are dead. They're dead. Had no problems with them.
Okay.
I didn't have any issues until I left the service.
How was your social life growing up?
I was in organizations. I was in what's called the Young Marines. And we basically did everything that a Marine would do, even shoot guns. We went to the naval base in near Wisconsin, and we wore the uniforms, did the parades.
What was it called? Young Marine?
Yeah, Young Marines, right.
Okay.
We dress up in the greens, we're all like 10 or something like that. So, yeah.
Cute.
Yeah, it was pretty, you camp and stuff like that. It was pretty nice.
Any significant romantic relationships prior to the military?
No,
Okay.
no. I was only 17.
Okay. You were a baby, huh?
Yeah, I was 17, right.
How about while you were in the military? How was your relationship with family? Did you stay in touch?
See, I was only in 5 weeks,
Uh-huh.
okay? So, we wrote letters back and forth. Everything was copacetti. But, again, I wanted to stay, even in that document, it says I wanted to stay in the Marine
Yeah.
Corps. But they, it's either start me over or kick me out. Those are the options.
All right. So, not much of a social life then while you were in the military. No significant romantic relationships.
No. I was in basic training. You don't get me.
Yeah.
Try to get in the camera here.
Oh, you're good. How about after separating from the military? Did you eventually marry?
No. I was homeless for 50 years.
Oh my goodness.
Yeah. 90 days after I get out of the military, I'm in a psychiatric hospital. I tried to commit suicide, and the doctor and my mother, we were having like a counselor meeting. You know, Bill. My mother says Bill is acting out more than usual. Okay, this is less than 90 days after I'm out of the Marine Corps.
Right.
And I left home, and I never went really back. You know, that was it. I went hitchhiking for 20 years, from 74 to 94. I couldn't tell you where I was, honestly.
Okay.
I could not. I don't have a clue. I was hitchhiking, traveling, going here. You know, I was just homeless all my life. I'm living here under a homeless program through the VA.
Okay. So from 1974 to 1994. Or have you ever been able to maintain employment?
No. No, I
Would
would.
you say that's due to your mental health?
Oh yeah. See, the problem is, and this points out Dr. Sigler, the CPT doctor. See, they tore me down, but they didn't build me back up.
Right.
You
right.
know, and
That
she
takes the
says that has as much effect on me. She said she believes it's like bipolar, because I asked. I says, so how do I find the etiology of bipolar? Well, everybody says you really can't, because there's like no specific blah blah blah.
Right. The scientific literature is not very clear. However, similarly with like schizophrenia or other significant mental illnesses, they can be triggered.
Yeah.
So you may have an underlying genetic predisposition,
Right.
and then a significant stressor can trigger or flip that switch on.
Yeah.
Fortunately, it doesn't get switched back off.
Right.
Once it's on, it's on.
Right. So Dr. Dema, which I saw for a year, he's the one that diagnosed me with bipolar, principally depressed phase. And everybody keeps on calling it just bipolar, and I know it's the world of difference. You know, they always forget the principally depressed phase, and they always forget the two, you know.
Well, I think the definition of it has changed over the years.
Yeah. Yeah.
So you're currently in a housing program for...
I'm on HUD.
Okay. Okay. So occupational and educational, how were your grades in high school?
It was C's and D's, you know. I did excel. Drafting was the one thing I really excelled at, you know.
Okay.
I didn't even know what it was when I first heard of it. I was like, I'm going to hate this stuff. I know I'm going to hate it, you know. But I do have one more question. I'm sorry to just...
Yeah.
Is there anything that you can't eat, if you know, in the whole world? Like Dr. Sigler, she couldn't eat fish. And I told her, I says, think about somebody forcing you to eat that fish.
Eat the thing you don't want to eat, right?
Right.
I understand completely.
Okay.
It's mental and physical torture.
It is. And that's what my lawyer says, Dr. Iofen, in the notes. He says, it is torture, you know, making me do that. And, yeah, I'm angry. I had 2 heart attacks, 2016 in 1 week. And it's from anxiety. I am consumed by uncontrolled anxiety. I have stomach aches sometimes a month long, and then when they
Well, we're gonna get to that. I want
okay, sure.
One thing
Sure.
at a time.
Sorry.
Any jobs while you were in high school?
Yes, I was working at a stalls, cleaning stalls.
Okay, like at a ranch.
A horse stall. Yeah, it was a stud service kind of, you know, arena.
What was your MOS in the military?
MOS. I don't.
Your military occupational specialty? They probably didn't give you one yet. It was
No.
Basic Marine.
Exact.
Okay. Interesting though that you still earned a good conduct medal.
Yeah, well, I didn't do nothing wrong. They kicked me out for passive aggressive, and I don't, if I'm not mistaken, passive aggressive is not even in the DSM books anymore, is it?
No.
No. So that's
the
the
military does something different. They'll say it was a personality disorder.
well, that's what he's trying to throw in, and my claim isn't about a personality disorder.
Yeah. Well, that's just that's they don't know.
Right. Exactly.
Military verbiage. It's military verbiage versus clinical verbiage.
I get it.
Um, Okay, so after you got out of the military, you were not able. Have you ever completed any education besides high school?
I only got to 11th grade.
Okay.
And
so
no.
You didn't complete high school.
No.
Oh, okay.
11th grade, 17 years old. Everybody else is going into the Navy. So I'm going. Since I did the Young Marines, you know, it was like
So you went in at 17.
Exactly. Yeah.
So have you ever been employed?
Very few. I got maybe $2,000 on taxes in my life. And what I've done is just travel town to town, clean awnings, paint parking lot lines, painting. A lot of times, most of the time I slept in my car, and I just, it seemed like every time I stopped somewhere to try to start a life, something happened, and I was just, the only way I could escape was just to go, like to run, I mean it. Don't get me wrong. I learned a lot. I learned I can fix my own car. I can do just about anything,
Yeah.
But 50 years by yourself is, not fun.
Well, it sounds like you're very creative.
I am. If you only knew.
We're gonna go into some of the mental health.
Sure.
Prior to the military, any mental health issues?
None.
None. While you were in, that's when mental health issues started, correct?
Yes. They said I was goal oriented when I came back from emergency leave. They say in that one piece of paper, that's all they're fighting me on. He is goal oriented into receiving a discharge. I don't know. You really can't do that in basic training. You are in Marine Corps basic training, man.
So you, what did you take emergency leave for?
She was having a serious operation, and she could have died. And
this was your mother?
yes.
Okay.
Had I not taken that, this wouldn't all be. We wouldn't be here
Why
right
do you
now.
say that?
Well, it was my fault for going in the military. I can't blame anybody, and it was my fault for taking emergency leave. It was my choice. So I kind of kicked my.
Did you differently after taking emergency leave? Is that it?
The military?
Yeah.
Oh yeah.
Okay,
Yeah.
so once you came back, the way they treated you changed.
Oh God, yeah. No.
Okay.
Let's do 50 calisthenics or push-ups for Mr. Perry, and it was just on and on and on. So yeah, they if I had $1 for every time I was poked in the eye with a brim hat, I'd be a millionaire.
Oh my goodness.
No, that's 74. They did things different.
Absolutely.
Vietnam War.
What kind of symptoms were you having while you were in the military? Mental health symptoms?
Dreams, I was anxiety. To this day, I get stomach aches that could last. The more anxiety I have, the less it, if I belch, it goes away. If I don't, then that means it's a lot of anxiety. And even my fibromyalgia, I am approved for that, but it's secondary to PTSD. But that sets off my fibromyalgia. My anxiety sets off my fibromyalgia too, because when they sent that thing that I'd never been, see the VA last year sent a document, and they say I'd never been clinically diagnosed with PTSD or bipolar. And I've got 12 doctors, and they never used any of them in my appeals, in my decisions, none of them, you know. And all my VA doctors, they left out of my problems. It took 12 years for the 2008 doctor to be put in.
Okay. So did you receive any mental health treatment while you were in the military?
No.
Okay. Didn't you say earlier that they sent you to psych?
They sent me, this is the interesting part, right? They sent me to psychological evaluation on November 15th. I came back from emergency leave on the 10th, all right? On the 11th, they asked for a psychic eval on the 15th. And the 15th, there are no records. There was no psych eval. What we have is the medical board piece of paper, and that's the document that's dated November 15th. So the psychological evaluation didn't happen, all right? I went in an office. He says, we're discharging you for passive-aggressive personality.
Okay.
And that was it, you know?
Yeah.
And there's no record. And even the commandant on the 15th signed this piece of paper. Now that's the doctor typing it up, getting it ready, getting it over to the commandant. This all happened in one day.
Okay.
The government doesn't move that fast. You know what I'm saying?
That's very true, Mr. Perry.
Did you want to see my license? I got it out too.
Oh, you're okay.
Okay.
You're good. Okay, so after you got out of the military, you went to a psych facility, correct?
When I got out of the military, I spent about a week at home, and I ran away, and I was doing drugs then, and I OD'd on a bottle of Valium, and they took me from the local hospital to Hines Hospital, which is in Joliet, near Joliet, Illinois, and put me in the psych ward, and
For attempted suicide.
yeah.
Okay. How long were you there?
I was there a couple days, and then I went home, and we did a couple meetings, you know, a couple, I guess, social worker meetings and stuff, you know, and I ran away, and I almost never returned again. I mean,
Did you seek any mental health help while you were homeless?
no. Heck, I didn't know. I was
Right.
lucky to eat that day. Where was I going to sleep?
Exactly. Yeah, exactly. Are you receiving any mental health care now?
I have a social worker, and I went to, like I said, I did the CPT, you know, program. And I got done, I think, in June or
What
August.
Is it CB?
Cognitive processing therapy.
Okay.
Yeah,
So,
12-week
cognitive
course.
Behavioral therapy?
Yeah,
Okay.
and it was in
Was that
Prescott
for the VA?
through the VA. She was the head of this team. That's all she did was PTSD, CPT.
CPT or CB?
I thought it was CBT too, but I literally have her notes right here in front of me.
The CPT?
Yeah. PCT, PTS, Clinical Team Diagnosis Assessment.
PCT.
PCT.
Okay.
Can you see? Which way do I got to move it?
No, you're good. It's just
Left or right?
move it to the left. Let's try that. Oh, nope, right. Okay, pause. All right, go up a little bit. PCT PTSD clinical team. Okay.
Yeah. And that was 12 weeks.
Okay.
You know, I learned a lot. I did help me. I won't lie. And I had a good doctor. She kind of like you, where she gets it. You know what I'm saying?
Okay. When did you complete that program?
I want to say like I started the first date. This was April 2nd, 2023. So 12 weeks and maybe 15 weeks because she had.
Okay, so like last year.
Yeah, it was last year, 2023. Maybe August, something like that, I think.
Okay. How are your symptoms currently?
Not good. Like I say, I'm dealing with uncontrolled anxiety, fibromyalgia. I'm depression. I rarely ever leave this apartment. I'm fearful of. Fearful is the wrong way. I feel if you don't go on the ocean, you're not going to drown in the ocean. All right, you don't go in an airplane, you're not going to die in an airplane accident. If I don't go out there with all the crazy crap going on in life right now,
right,
and police out here, this is Bullhead City, so if I stay here, I know I'm safe, and if anything happens to me, I do a lot of hiking, done the Grand Canyon, done a bunch of stuff, but if I get hurt out there, no one to take care of my pets.
Okay.
So honestly, I've been sitting in my apartment for like 4 years, and that's in all my progress notes, everything. I rarely go to Walmart back here. I save a lot of money, but it's not much of a life. What hurts me most, it's every day you're alone. Birthdays, holidays, Christmas, you name it, every day.
Have you ever been treated for bipolar? Have you ever taken a mood stabilizer?
I have, and Dr. Ramadan here in Mojave Mental Health gave me a drug. I gained 30 pounds in 3 weeks.
Right, Depakote.
Something like that,
Yeah.
And so I had to get off of that because I was like 265 pounds now. I was walking up a flight of stairs.
Have you been having any hypomania?
I was explained to where I try to learn about that, but I go through phases like 50 miles of the Colorado River I just did.
Okay.
You understand?
Mm-hmm.
And that's my social worker. We're tight. She just retired, and she explains that is hypomania too.
Yeah.
I go
hyperfixation, lack of need for sleep.
Exactly. I've done the Grand Canyon. Literally, I have all this on YouTube, my GoPros and stuff.